If you are approaching 65 or helping a parent sort out Medicare, there is one detail that quietly trips up a lot of people. Sign up at the wrong time, and the government can add a fee to your Medicare premiums that follows you for the rest of your life. It is called a late enrollment penalty, and it applies to two of the main parts of Medicare: Part B, which covers doctor visits and outpatient care, and Part D, which covers prescription drugs. The frustrating part is that these penalties are usually avoidable. They do not exist to trap you. They exist because Medicare needs people to enroll on a predictable schedule. But if no one explains the timing, it is easy to miss your window without realizing it. In this video, we will walk through how each penalty is calculated, why it is permanent, and the specific enrollment periods that let you skip it entirely. None of this is personal advice. Rules and amounts change, so we will point you to official sources along the way. Medicare timing revolves around a few key periods. The big one is your initial enrollment period. It is a 7-month window that starts 3 months before the month you turn 65, includes your birthday month, and runs 3 months after. That is your main, no penalty chance to sign up for Part A, Part B, and a Part D drug plan. Most people get Part A for free because they paid Medicare taxes while working, so it rarely causes penalty problems. Part B and Part D are where timing really matters. There's also a general enrollment period each year, from January through March, for people who missed their initial window. Signing up then often means a penalty and a wait for coverage to begin. The point to remember is simple. The 7-month initial enrollment period is the clean, straightforward path. Miss it without a valid exception, and the clock starts ticking on a possible lifelong fee. The Part B penalty is the one that surprises people most because it grows the longer you wait and then it sticks. Here is the structure. For each full 12-month period you could have had Part B but did not sign up, Medicare can add 10% to your monthly Part B premium. So if you delayed for 2 full years without a valid reason, that is roughly a 20% increase. Wait 3 years, and you are looking at about 30%. And this is not a one-time charge. The higher premium is added to what you pay every month, generally for as long as you have Part B, because the standard Part B premium can rise over time. The penalty amount can effectively rise with it, since it is calculated as a percentage. The exact dollar figures change year to year, so always confirm current numbers on Medicare, Gov rather than relying on an old estimate. The key idea is that the cost compounds with delay and then becomes part of your bill indefinitely. The Part D penalty, for prescription drug coverage, works a little differently, but with the same permanent sting. It is based on how many full months you went without Part D coverage, or without other creditable drug coverage, once you have gone 63 days or more without it after your initial enrollment period ended. Medicare multiplies the number of those uncovered months by 1% of a figure called the National Base Beneficiary Premium, which is set each year. That amount is rounded and then added to your monthly drug plan premium. Because the base figure can change annually, your penalty can shift slightly over time too. People sometimes skip Part D because they take no medications at 65, then enroll years later when they do, and only then discover the accumulated penalty. That is exactly the scenario the rules are designed around. The neutral takeaway is that even if you do not currently need prescriptions, going without qualifying drug coverage starts a counter that can cost you later. A natural question is why these penalties are permanent instead of a simple late fee you pay once. The reasoning is tied to how insurance pools work. If people could wait until they were sick or needed expensive care before enrolling, healthy folks would delay, premiums for everyone would climb, and the system would strain. The lifelong penalty is meant to encourage timely, consistent enrollment, so the risk is spread fairly across the whole group. Whether or not you find that fair, it helps to understand the logic, because it explains why Medicare treats the penalty as ongoing rather than a one-and-done charge. There are very limited situations where penalties can be reduced or removed, such as certain low-income assistance programs or a successful appeal if you believe a penalty was applied in error. Those are case by case, so a licensed agent, your state health insurance assistance program, or Medicare directly can tell you what applies to your situation. Here is the good news that often gets buried. Many people legitimately delay Part B or Part D and pay no penalty at all because they qualify for a special enrollment period. The most common reason is having current, qualifying coverage from an employer, either your own active job or a spouse's, when that employer is large enough for the coverage to count. While you have that creditable coverage, you can usually postpone Part B and Part D without penalty, and then enroll within a set window after the job or that coverage ends, typically up to 8 months for Part B. The catch is that the coverage has to genuinely qualify, and retiree coverage, or COBRA, often does not count the same way active employer coverage does. This is a spot where assumptions get expensive. Before you decide to delay, it is worth confirming in writing that your coverage is considered creditable and checking the exact deadline that applies to you. A few recurring mistakes cause most penalty problems, and they are easy to guard against once you know them. First, assuming Part A is enough. Part A is hospital coverage. It does not cover most doctor visits or drugs, so it does not protect you from Part B or Part D penalties. Second, mixing up COBRA or retiree plans with active employer coverage. Those often do not count as creditable for delaying Part B, which means the penalty clock may already be running while you think you are protected. Third, missing the 8-month window after employment ends. Waiting for the next general enrollment period instead can trigger both a penalty and a coverage gap. Fourth, dropping a Part D plan and going several months with no qualifying drug coverage. To stay on safe ground, keep records of your coverage, note your deadlines on a calendar, and verify anything uncertain with an official source rather than guessing. Because rules vary by state, insurer, and personal circumstances, what is true for a neighbor may not be true for you. The honest bottom line is that the Medicare late enrollment penalty is real. It can last a lifetime, and it is also very often avoidable. The path that protects most people is straightforward. Know your 7-month initial enrollment period around age 65, enroll in Part B, and a Part D drug plan during that window, unless you have genuinely qualifying coverage that lets you wait. And if you do delay, confirm your coverage counts and act within the special enrollment period after it ends. None of this guarantees a particular outcome or saving, and it is not individualized advice. Medicare rules, premiums, and penalty amounts change over time and vary by state, insurer, and your own situation. So treat this as a map of what to watch for, then verify the specifics. The most reliable sources are Medicare, Gov, the Social Security Administration, and a licensed agent or your free state health insurance assistance program counselor, who can look at your exact circumstances before you make any decision.